Thank you. So a little bit of introduction, just to let you have a picture. This is a benign bone disease affecting mainly young guys, and can be very extremely, I would say, painful, affecting quality of life of this patient population. There are out there many treatment options. Basically what we do presently is percutaneous ablation. And let's see if we anyhow have changed this. This is a case of the treatment that we have done. As you can see, there is nidus, which is the small round lesion in white, and on the bottom there is also the perfusion study, where you can see there is a lot of vascular structure going into it, and there is also a lot of edema. After the treatment, the edema disappears, and sometimes you still have some perfusion within the nidus. Now, we were able to demonstrate the safety of the MR-guided focused ultrasound technique in treating osteoid osteoma in a pilot study, and then we eventually demonstrate also that it's effective in a short term. Now, the question is, how durable is your treatment? That was since the very beginning. So we undertook a study to prospectively investigate the mid to long-term efficacy of MR-guided focused ultrasound treating osteoid osteoma in a reachable location. That means basically outside of the vertebra and outside of the skull. We did follow-up of these patients for 3 years, and it was conducted in 2 centers in Rome and in Bologna. So what was the initial idea of the study is that we collected all the treatment starting in 2010, and we wanted to see how the lesion was feasibly treatable, the durability of the treatment itself, and also we wanted to look for the effect on the bone. So in terms of feasibility, we looked for an analysis of the lesion in terms of specifically of location. And when you see that there are some lesions that are really difficult to access with the system, that you need to imagine coming outside in a tiny portion of the body where the skin is right there, you can burn the whole thing. But we actually ended up being very precise, and with experience we gained a lot of safety profile also. This is the lesion that I showed you prior to the treatment, and this is immediately after the treatment. As you can see, the nidus was off, and there is some hypervascular structure around it, which is just inflammation, so it resolved without any burning. In terms of durability, one point very important is the control of the lesion, meaning that you aim to shut down the perfusion as much as you can, like as you can see in this case. Sometimes you leave some perfusion into the nidus, which eventually makes the lesion without pain after that, but with the bone abnormality still there. It didn't resolve. The pain went away, but the abnormality of the bone stayed there. So in terms of bone remodeling, we looked also to remodeling, and as you can see here, the lesion completely went away, and here are the 3D rendering. And those are the results at 3 years. So we actually well performed in the overall pain-free, the nocturnal pain-free, and also in the function restoration. That was a great achievement. And here is probably one of the most impressive cases that I have, where everything resolved over time. But the real point of this patient is that the day after the treatment, it was pain-free, since the very after day. And it was stable over the 3 years follow-up. So in terms of overall VAA score, we had pain zero, stable all over the follow-up months in almost 90% of the patients. So just to sum up, our clinical outcome demonstrated that we can be very effective without any adverse events so far in our population. The clinical efficacy is durable, and there is a great tolerance profile from the patient. Thank you very much. Do you have time for questions?
Yeah, I think so. Any questions for Dr. Napoli? I have one quick question. Any non-contrast findings on MRI that you feel like are associated with treatment response, or is it mostly the perfusion changes that you think are most associated?
I like very much. The perfusion is very straightforward, so I rely a lot on it.
Yeah.
Do you do any other imaging modalities?
No, but sometimes I feel like I see a little bit of change of the T1 signal in the nidus following the treatment, and I just wonder about that as well.
I actually didn't look at it, but I do have that data if you want to go based on that.
That'd be great.
Yep. All right.
All right.